Number 11 is called Medical Education Part 1. The first exercises match these activities to the stages of medical education in UK given in A opposite. First one, dissecting cadavers, preclinical stage. Number 2, keeping a log of surgical procedures observed and performed, clinical practice. Number 3, working in 4 months working for 4 months in accident and emergency to experience this specialty, clinical placements. Number 4, taking a 4-week attachment in obstetrics and gynecology, clinical placements. Number 5, taking an online course on recent development in cardiovascular disease, CPD. Exercise number 2 says complete the sentences. Look at B, C, and D opposite to help you. Just before their final year, students have the chance to take an elective in hospital of their choice anywhere in the world. Number 2. The integrate curriculum contrasts with an approach where each subject is taught separately. Number 3. These days, classes are often interactive, with regular opportunities of the students to ask questions. Number 4. The clinical year students learn how to treat and manage patients. A foreign language can be a topic from outside medicine, such as dissection of cadavers. Is an important part of the anatomy component. The UK Medical School at the University of Edinburgh is one of the oldest in UK. She is a consultant of the Royal, one of the leading pediatric heart specialists in the country. The Royal College of Surgeons in Edinburgh dates from 1505. We have a seminar each week where we discuss topic in a small group out of the lecture. The last exercises match each of the activities to one of the components of the undergraduate course describing in B and C opposite. Number 1. Julie spends 6 weeks working in a small hospital in Himalayas. Elective. A group of students discuss together the possible reasons for abdominal pain after meals in an obese man of 44-year-old. Small group learning. A small group of students trace a pulmonary artery in a cadaver. Anatomical practice. Otto spends a month working in a pediatric ward of the local hospital, clinical placement, and learns how to take blood from the elderly patient, clinical skill. Juma chose to study travel medicine in his 4th year, specialist interest module. Unit number 12 is called Medical Education Part 2. Complete the phrases with verbs in the box. 2 phrases can be completed in 2 different ways. Look at A, B, and C opposite to help you. The words are assess, deliver, demonstrate, provide, supervise, and take. The first one says demonstrate a competence or how to do something. Supervise a trainee by ensuring she successfully completes her training. Deliver a course or training program as a teacher. Take a course or training program as a student. Assess progress or competence. Exercise number 2. Match the 2 parts of the sentence. Look at A, B, and C opposite to help you. An FI1 is a doctor in the first year of the foundation program. A demonstrator is an anatomical teacher who teaches dissection. A clinical trainer is a consultant responsible for the training program of a trainee. A supervisor is a consultant of a body of specialists responsible for delivering and assessing training in their specialty. A medical school is a part of the university responsible for medical education. A placement is a period spent as a trainee in hospital or in general practice. A college is who provides training during periods or or direct clinical care. A fellow is a specialist who has reached the highest level in their specialty. Exercise number 3. Write in full qualifications of the doctors and surgeons. Mr. A. H. Jones' husband, M.B. C.H.B. F.R.C.S. F.R.C.S.I. Bachelor of Medicine and Bachelor of Surgery. Fellow of the Royal College of Surgeons. Fellow of the Royal College of Surgeons. Number 2. Dr. C. Doyle. B. Med. SCI. DM. MRCP. Bachelor of Medical Science. Doctor of Medicine. Member of the Royal College of Physicians. Number 3. Mrs. E. Inglis. MBBS. FRCS. Bachelor of Medicine on Surgery. Fellow of the Royal Category of Surgeons. Dr. E. Meriwether. BM. MD. FRCP. Bachelor of Medicine, Doctor of Medicine, Fellow of the Royal College of Physicians. Unit 13 is called the Overseas Doctor. The first exercise says, what kind of registration might this doctor obtain? Look at A, B, and C opposite to help you. A newly qualified Spanish doctor, provisional registration. A newly qualified Nigerian doctor, limited registration. A doctor who has successfully completed the first foundation year, full registration. An SHO who has successfully completed the foundation program and gained a certificate of completion of training after several specialist registrar posts. Specialist registration. Exercise number 2. Write the abbreviations in words. Any doctor who wants to work in the UK must be registered with GMC, General Medical Council. 2. Some overseas doctor must pass the PLAB test before they can register. Professional Linguistic Assessment Board. Number 3. Part of the test consists of OSCE, Objective Structured Clinical Examination. Number 4. In any emergency, remember the ABC protocol, airway, breathing, and circulation protocol. Number 5. Before you can obtain specialist registration, you must have the CCT, Certificate on Completion of Training. The last exercise says, complete the test. Look at A, B, and C opposite to help you. My name is Musa, and I come from Yemen. I came to the UK about 2 years ago, after graduating. Because Yemen is outside of the EEA, I could only obtain limited registration with the GMC at first. It was very difficult for me to obtain a place on a foundation program, although I speak good English. I had to take the PLAB test to show that I could work safely in UK. If I have to give some advice to other candidates, I will be that consulting OSCE, you shouldn't simply memorize a set of phrases. It's better to really think about what you're saying to the actor and get to the annotation right. After completing my year clinical training, I was able to obtain full registration, but I found it difficulty to get an SHO post in my chosen specialty, pediatrics. As a hospital now have to demonstrate there is a suitable candidate from EEA. Once I have completed my second foundation year, I should obtain CCT, which will allow me to proceed to specialist registration with the GMC, an important step on the road to become a pediatric consultant.